Hi, we are Group 6. Welcome to our presentation on Costa Rica. My name is John Chavez. I'm with Asia Gilliam, Toby Oluwatu, and Sarah Stone. Some of the things we are going to be talking about are, after the introduction, is Costa Rica's background, primary health issues, the system overview of Costa Rica, summary of the issues going on, our project focus and rationale along with our proposed innovation, Costa Rica as a market for innovation, and our summary. Costa Rica is famous for demilitarization and health insurance program attracting expats from the north and south among all the Latin American countries. Costa Rica has overcome some big hurdles in implementing its healthcare system and is praised by economists after transitioning to a near universal health system in 1970s. One of the big issues is increasing age and ailing population within Costa Rica. This is causing the health system cost to exceed system offerings. Our goal is to propose an innovative HTA to address the financial and systematic instability of the system while promoting the assets of the current health system. Costa Rica has been inhabited as far back as 5000 BC by the indigenous people. There are many migrations and influences from all sorts of Aztecs, Mayans, and Incas. Christopher Columbus landed on this small island located by Limon in 1502. In 1522, the colonists named the land Costa Rica, meaning rich coast, and hopes that they would find gold in the hills. The main sources for economic growth and sustainability within the country has relied mostly on exports of bananas, coffee, sugar, beef, with tourism contributing to a major portion of the GDP as well. Costa Rica has one of the highest rated education systems in Latin America, and it ranks higher than its neighbors in both social capital and wealth. However, despite these positive gains, the poverty rate has remained a challenge. When Nicaragua erupted in violence, the migration challenge also challenged Costa Rica's exclusivity of accepting other groups and exposing undercurrents of anti-Nicaraguan prejudice. The average inflation rate for Costa Rica for the last 20 years has been around 4.4%. However, within the last year, many steps have been taken by the government to correct this. To maintain the trend of reducing spending, both the president and the finance minister insisted on the need to restructure the public debt, which fell in the last year from 5.4% of the GDP to 53.7%. Now, Asia will talk to you about some of the health issues.
Thank you, John. Some of the primary health issues for Costa Rica are high diabetes, obesity, high physical inactivity, chronic respiratory conditions, all of which require consistent system use and higher charges. The ultimate burden in the health system is overspending with little data on efficacy of improvement. On to the next slide. The role of Costa Rica's government in this health system overview is that the health system is ran primarily by public and private healthcare providers. About 15% of primary care is delivered independently by a provider. Community clinics called e-bias were established in the early 90s to provide outpatient services that included community medical services, health promotion, family planning, and disease prevention intervention. The health system is managed by a financial division of CCSS and Ministries of Health. Costa Rica does not do well with disciplining their budget, and they spend the money as the funds are delegated. They're not able to reallocate or decrease the amount being spent. So hospital activity increases, medical salaries are increased by the prices and are not controlled effectively. The three non-public hospitals, Clínica Bíblica, Sema Hospital, and Hospital La Católica, are the main private health systems for Costa Rica. The hospital units are related to U.S. hospitals and licensed with Joint Commission International. On to the next slide. Majority of the services covered, emergency and maternal, are free. The coverages cover everything from checkups to prescriptions and surgeries. Some procedures are elective and out of pocket. The cost sharing out of pocket expenses have risen since 2015, which has been a concern for Costa Rica. A suggestion for a long-term remedy in Costa Rica is to depend on government budgets more and less on the labor market for revenue. Costa Rica are looking into things that can be taxed in order to fund the healthcare system. On to the next slide. Some health system innovations, such as the payment system, has been put into place. The system allows the value and the patient outcomes to have improved rewards. The payment system allows the money in the healthcare system to be properly tracked, providing physical evidence that the financial needs are being met. The government also would like to control over the health system spending, modernizing the primary care delivery and using quality of attention and system to sustain the system. On to the next slide. The cost spending is becoming a significant problem. According to WHO, out-of-pocket expenses has increased, growing from $80 to $200 per person, with the majority of the cost towards medical consultations and medication. Some of the access to the resources have progressively been distributed. The poorest quintile receive 29% of spending, while the richest quintile receive 11%. Some of the quality control that's put into place are the primary care performance framework. This tool are indicators in the system that track domains of access, continuity, effectiveness, efficiency, patient satisfaction, and organizational ability. The People's Health Centers are home health care that's established as part of the health network. They use digital journals to track patient records, treatments, test results, diagnosis, and appointments. Hospital discharges are systemized to help with discharge and from the time a patient is admitted all the way up to discharge. Now I will pass this along to Toby.
Thank you, Asia. Thank you, Asia. So moving on to the next slide, we're going to talk about stakeholder analysis. Stakeholders have been classified based on their interest or expectation and power or influence. And we've been able to identify 5 stakeholders, which are federal government, the health ministry, CCSS, providers, and the patients. Moving on to the next slide. We want to talk about the SWOT analysis. It's important to note under the strength that overall the citizens are very satisfied with the health system. And under weakness, we see some issues. The country is actually known for excessive wait times for specialty care and highly dependent on emergency care. And under opportunities, there's an opportunity for improved access to care and adoption of new technology. And under the threats, we see that the country is actually ripe with aging population and chronic diseases, which obviously increase spending and utilization of resources. And to the next slide, talking about the SWOT strategy, leveraging opportunities with our strength, it's important to understand that the country can take examples of advanced technology and devise low-cost means of mass implementation. And also under the strengths and threats, it's also important for the country to understand that spending could compromise the quality of the care system. And in terms of weaknesses and opportunities, the instability of the financial part of the government can actually lead to new ideas for meaningful that have meaningful impact. Also, under weaknesses and threats, so many parties can actually impact the funding for the care system. And to the next slide, our main project focus and rationale include economic downturns, which reduces obviously reimbursement for providers and reduces quality, and which overall puts a strain on the healthcare system. And therefore, it's important to know that a cost-effective solution is a must in order to improve innovative opportunities, and grow access and reduce spending. I would now pass it on to my colleague Asia. Sarah, I'm sorry.
Thanks, Toby. In order to address this problem for Costa Rica, we suggest forming and implementing a health technology assessment body, which is an evaluation body that assesses healthcare technology and innovation, addressing overall effects and consequences, and is aimed mainly at informing decision-making regarding health technologies across the system's needs. This body will evaluate all levels of healthcare innovation, including procedural tools, drugs, etc. Essentially, we're trying to implement the best technology for the least amount of money. And as Costa Rica has a public health system, cost is important. It's similar to the NICE system that we read about in England, identical but not similar, or identical but similar. For Costa Rica, they require more accurate data and information to make better budgeting decisions and avoid further political intervention and complications. This combination really will revise the financial model to maximize funds efficiently. As you can see on this diagram, it breaks down more specifications for an HTA body, evaluating technology and interventions such as pharma and procedures, and even going into delivery models and public health initiatives. Considerations from efficacy to public safety to budget must be analyzed, leading to the participants required for comprehensive analysis. The specific parameters would be unique to Costa Rica, but representation in relationship to interest is necessary for a smaller but successful health system. Moving forward. Costa Rica is primed for innovation, as currently the central government and healthcare providers work in tandem to manage debts and financial instability. So different systems are accustomed to working together, such as with the adoption of EHRs. CCSS and the central government want to meet healthcare needs efficiently and equitably, satisfying all stakeholder objectives, which is vital for a country to be open to innovation. Next slide, please. Further evidence of Costa Rica as a market for innovation is the potential application of proposed ideas for increased adoption of DRGs, robust controls for public expenditures, expanding the supply of healthcare workforce, choice of providers, and performance management in hospitals. As mentioned, the different components of government are already accustomed to working together cohesively, so adoption of HTA bodies only consolidates communication and provides more firepower to good ideas. Moving forward. As listed earlier with the stakeholder analysis, there are numbers of parties with a vested interest in the plan to implement an HTA body. Forces for change include patients who want increased medical offerings, providers who want increased compensation and new tech, government who needs accurate data for budgeting, and weighted the highest, health systems wanting to remain viable. Forces against the change include political motivations, further economic downturn that could leave results stagnant, new data that could backfire and destabilize the system, and most importantly, the time and effort may not yield actionable results. So there are a number of elements influencing the possible change of the implementation. In summary, Costa Rica healthcare system is successful amongst WHO and OECD standards, but there is room for improvement. By implementing a national HTA body to provide recommendations on technology and system controls, Costa Rica could reduce spending and institute system reform in a manageable way. We recommend they consult with a UK program such as NICE or NIHR for strategic implementation. They identify representation for an HTA body with representation from each stakeholder group. They assess all relevant medicine, pharmaceuticals, procedures, etc. quarterly and assess results in the next federal budgetary cycle. The Costa Rica healthcare system is well regarded due to its positive outcomes, comprehensive care, and historically low costs. In order to remain viable in the future, however, Costa Rica needs to make changes, embracing alternative methodologies and innovations to best care for its systems. Please refer to appendices 1 through 4 for further analysis on the Costa Rican healthcare system. Thank you very much for your time, and we look forward to your questions.